I'm going to move to the panel now, and I would like to thank Sue, Natasha, Ragini and Paul. And you've all touched on the need to ensure that implementation of evidence-based practice is sustainable. And as mentioned by Claudia at the start of the symposium, that's certainly a key focus of our research here. So Paul, I will just go back to you now, just to follow up. Can you share an experience of how ensuring sustainable practice and how you've actually measured that over time with your behavioural change to your organisation? How have you ensured that it's continued and how have you measured that?
Yeah, I mean, I think the way in which increasingly we're doing it is what I said about developing that logic model. And right from the word go, I don't think you should be ever designing a behavior change intervention without thinking about sustainability. So instead of just we've gone in my area of child obesity, we've gone beyond measuring impact at 1 year to think about 3 years and 5 years. And I think resourcing is really critical. And that's part of why I made the suggestion that you need at least 2 or 3 years in your project plan and your funding, because evaluation takes longer than people think. It takes a time to set projects up and therefore prove that things are sustainable. And very often people just run out of time and resource to prove all of the good work that they've done, and then it becomes easier to defund things.
Fantastic. How about you, Sue?
I think where I've seen it most successfully done is where they are actually small changes that build. And I think you build your impact. And I think that comes from the fact that none of us are very comfortable with change. And so implementing something small that's doable and then building on that success, I think makes it sustainable.
Fantastic, thank you. And I want to go to Natasha and Ragini and you, Sue, again. From a funding perspective, how does MRFF monitor and evaluate the long-term impacts? You know, what are your measures of success long-term of all the projects that you're funding? Do you go back and evaluate what they've done and whether it's sustainable?
Thank you, Judy. I can take that. So, as you've already noted, impact is a longer-term measure, and even in the introduction to the symposium in the text, was noted that it can take about 17 years for research to feed into clinical practice. And so we recognize that it's not just a linear relationship between research and impact, and the value of tracking those success stories along the sort of trajectory of a grant over time. So what we've done for MRFF grants in particular is we've, as Natasha touched on briefly, developed the monitoring, evaluation and learning strategy. And as part of that strategy, we've articulated these 5 long-term impact measures. For example, economic growth, increased health efficiency. And they are supported by 8 measures of success, which we ask all grantees to sort of include as part of their application. And also, thank you, Georgina, for sharing that slide. That's precisely it. These measures of success underpin our evaluation framework. And underneath all of this, of course, are the performance indicators that are used to measure success over time. So we're still very new in a way in terms of assessing impact in the MRFF space. And at this stage, we're trying to gather information and data from our grants, from the projects themselves through reporting, but also through surveys that we hope to sort of repeat every 3 years. And once we've had enough information, we can really start to see the impact MRFF is having out there in the real world. But it is something that we're always cognizant of and trying to ensure we are addressing through every grant opportunity and application process.
Fantastic, thank you very much. And Sue, how is ARIIA going to measure success in terms of long-term impact from all the projects that you've funded? Because you've only been in action for a short time. What does that look like?
And I think, you know, one of the challenges of ARIIA is having a 3-year funding time frame and actually getting the money out the door, getting the projects completed over such a short period of time. But people are doing it. And I have to say that I see these projects as really a proof of concept in many ways. They are seeding grants. And the great opportunity that we have is to be able to feed the outcomes of those projects directly into the Department of Health and Aged Care. And so we've got about our first 4 final reports in now. And so I'll be sharing that with government. And I think it just provides a really nice loop of what's being funded and what's being found. And of course, you know, we are looking at ways of taking those outcomes that have been really positive and scaling them up. What is the next step? You know, what is it that we need to do now to take those really good outcomes and build upon them and not let them go dusty on a shelf? And I think that's a really important thing that sometimes doesn't happen with grant funding, you know, groups. Yeah.
And I suppose then sort of putting it back into your website, perhaps in the Innovation Hub, so that people can see who's done what, how it can be done, and who the contacts are to help them do that broader implementation.
All of those links will be there, and really negotiating with each group about how much they've got to share, how they want to link in those resources that they've developed. Really important that we don't lose the valuable work that's been done.
Fantastic, thank you. So now I pose a question to all of you, because we know that collaboration within and across sectors, you know, for example, providers, universities, tech companies, is absolutely vital for implementation. So how do you find that this is encouraged by funders, and what is important to get right for these collaborations to be successful? Who wants to go first? Have you got anything, Paul, from your perspective with the UK US?
So I think it always takes time. It takes a long time to get to know collaborators, make sure you're talking the same language before you start putting the grant in. I've seen a lot of grants where people use words, they're using the same words, but they're talking about completely different things, and they really haven't sat down and thought about how X is going to lead to Y. So if you like, I'm passionate about interdisciplinary research. So much of it is not interdisciplinary research. How exactly at the theoretical level, at the methodological level, at the kind of data processing level, at the interpretation, how exactly are you going to take this model and this model and bring it to do that before you put the grant in, or give yourself a year or 2 of sitting down and really working that out, because it's going to save so much angst when you get the grant. It's going to make it, hopefully it will make it more likely that you'll get it. It will save angst when you're doing it, and it will lead to outputs that are meaningful, because I think so many times outputs are fudged, and they don't, and the bit that gets fudged is the interdisciplinary insights.
Yeah. Thanks very much, Paul. And of course, that time is not funded, which can be very difficult when you've got KPIs to measure. So have you got any thoughts from your perspective?
Yeah, look, I have. Our aged care partnering program was specifically around this, bringing the right teams together. And we've got one grant that we funded that I think is just an amazing example of how, when it works well. So we had an aged care provider that was particularly interested in dehydration in their residents. We also happen to know of a company that had been measuring dehydration in miners and soldiers. And so putting them together to understand what is the osmolarity of older people, and can you use that technology to actually identify people that are dehydrated. And, you know, when we think about our group of people with dementia, end of life and so forth, you know, and so that project's underway. And that was about bringing them together. And they had that common purpose. They had a shared problem that they had been managing in different ways. And I think, you know, that's a really good example of when it does work well. It's not always possible to bring everybody together. And what Paul said, you know, people saying the same thing, but it means different things. And the different language between a software developer and an aged care provider and a clinician and so forth is one of those things that we really do have to work at, is understanding each other. But I think where there's a shared purpose, I think it's possible. So, but we're really looking forward to seeing the outcome of that project, I must say.
That's very exciting, Sue. What about the MRFF? How do you encourage collaborations?
Yes, so thank you very much for that. So yes, there are a couple of ways that we do that. As one of the things, and that's for us, it's one of the real purposes of the MRFF itself, is about having a focus on collaborations and partnerships, and really trying to bring together, as I said, consumers, patients, industry, researchers, to be able to work together and actually deliver that research grant and that research project jointly. That also includes, we do have some very specific opportunities that are classed as consortium. So we do set that up very deliberately to not only enable, but very much to push that sort of arrangement and working together as well. Ragini did mention about forecasting, that we forecast when we're going to be putting out grant opportunities. And in some ways, I mean, one, that's just helpful for individual organisations that might be thinking about putting in a grant to be able to see what's going to be coming up. But it also enables those conversations to be happening earlier around, we see that there's going to be a grant opportunity on a particular topic, and we know that there are other people that we can partner with, and it means they can start having those discussions earlier and start planning in that space to actually do it in a collaborative way as well, rather than simply being surprised when the grant opportunity is published.
So tell me, with all the data that you collect, and I know you can't answer for the NH and MRC, but you know of the network of researchers across the country, the things that they're specifically researching, do you ever try and encourage people to come together to do bigger grants on the same thing, given that you've got all of that data? Because we're just aware that there are lots of little pockets of research doing the same thing in different parts of the country. And I'm just wondering, is that something that MRFF, NH and MRC, ARIIA could think about doing it together?
So that's a very good question, Judy. We don't proactively connect people to each other per se for grants, but what we're trying to do is highlight sort of the research areas and the sorts of research that is occurring across MRFF, in the hopes that it will inevitably help forge those connections. What we also try to do is we quite regularly engage with the peak bodies, with organizations, institutions, constantly having discussions around how we can better support them or help connect them, essentially with other researchers and other groups as well. But also sharing those good news stories, I think, is a great way for us to help facilitate that collaboration. So, but there's no sort of direct matching of applications at the other end, so as to speak.
Yeah, for sure.
That either MRFF or NHMRC does at this stage.
It'd be a good thing to do, though, wouldn't it? How about ARIIA, Sue? Because I know you're trying to forge connections, aren't you?
Certainly that aged care partnering program we've used really strongly as a matchmaking, and for our grants there had to be an aged care provider and a university at a minimum, and then we encourage them to have other organisations. So and we do have webinars where you know, if there's some technology, we actually bring the aged care providers in to comment on, you know, the ideation and what's being developed and so forth. So we do try to be a bit of a matchmaking organisation. But I think it's a good idea, particularly as we move to more scalable interventions. You really do have to have more grunt in your teams, and how's, you know, the best way to actually do that. So I think it is important.
Fantastic. And Paul, have you seen this happen in the United Kingdom or now in the US, where they have the matchmaking service of great minds alike?
I don't know whether they do have a matchmaking service, but certainly organisations like the NIHR, when they evaluate grants, they make recommendations about how to strengthen it, who should be involved, and so they can be quite suggestive in an interventionist kind of way.
Fantastic. Look, I'm just aware of time. Look, I'd like to thank all of you, but in closing, the focus of this symposium is on implementation in the real world. So what is the best piece of advice you have to steer people in the right direction? Sue?
Oh, the best piece of advice. Just be prepared for that non-linear. Nothing is going to go as you expect. Be flexible and be nimble, because it is a complex. I think Paul's diagram, that complexity is what you'll find as you start on this journey. So being flexible and be kind to yourself on the journey.
Thanks, Sue. Paul? Last words of wisdom.
Probably what Sue said, and I think take time to get to know the system, the people in the system. Behaviour change is something you do with people, not to people. So I think nothing will help you understand the system and all its things that need to be addressed than getting to know people.
Thank you. And Natasha and Ragini, have you got one last thing to say?
It is very similar to Paul's comment as well, and that is really about working with consumers. So that means not just patients, of course, but in those instances where it's a patient, their family, their community as well. So not just the individuals, but working with them to understand what the research problem is, and that they are engaged throughout the whole process, right from start to finish.
Fantastic. Thank you very much.